Hello, my name is Alexis Vega, and for the first lab, I'm going to teach you how to correctly take blood pressure. So, without further ado, let's begin. So, important factors that we want to remember is to make sure the patient does not consume any caffeine or stimulants at least 30 minutes prior to test. Make sure the student sits up, make sure the legs are not crossed, and that the left arm is extended on the desk. Check for appropriate size of the cuff. We don't want to be too big nor too small. Before beginning, notice how the patient's clothes are going to be loose fitting and comfortable. Now, before we begin, the stethoscope is going to be around my neck and is going to be with the prongs facing inward. Now, when I'm placing the cuff around the patient's arm, I'm going to place it on the bare skin. And I'm going to place the white arrows facing downward. And this is going to be specifically for her brachial artery. I'm going to tie it around her arm, making sure that the white tag, as you can see right there, is placed in the correct spot. And I'm going to tightly wrap the cuff around her arm. I'm going to make sure and ask her if it's too tight. She says it's comfortable. And from there, I'm going to grab the bulb and the valve. Now, getting everything ready. Stethoscope is going to be in my ears. Again, prongs facing inward. Valve is facing me, and we can begin. Now, with the cuff around her arm, I'm holding the actual valve, and I'm going to inflate it up to 200 to 220, making sure that depending on the size of the person, and making sure that it's going to reach a good amount of pressure so I can check her actual blood pulse. Right now, she's holding it for me so I can get a better view of the valve. Now, I am slowly releasing the valve and releasing pressure from the actual cuff at anywhere from 2 to 5 mmHgs. I'm slowly releasing it because I want to be able to hear the systolic and the diastolic. The systolic being the first sound that you hear. Notice where the bell is placed. The bell is going to be placed right on her elbow by her brachial artery. She is breathing, staying completely still, and I am reading the first sound. As I keep listening, I will notice that the last sound, aka the diastolic, would be the very last sound you hear. Now, things to remember. Blood pressure works in MA and mmHgs. Blood pressure is expressed as systolic, the first sound, and diastolic, which is the last sound. If her first sound was at 160 and the second at 80, then the blood pressure is 160 over 80 mmHgs. What's next? Now we will let the patient rest for 5 minutes and repeat the process 2 more times for a total of 3 total trials.